Hi, everyone. Let me hope you are just doing well. I have something I would like to share with you. I'm Dr. Miriam Smith, the host for Empowering New Nurses. And today I had the pleasure of being with a community of nurses. It was so empowering hearing different experiences from both young, from entrepreneurs, nurses in different spaces. And that's encouraging because you could hear the community, you could hear the hospital setting, the inpatient setting, the outpatient setting. It was fascinating to me. And yesterday, I was actually at a museum. My daughter did a great presentation in her STEM field. STEM, that means science, technology, engineering, and math. She's an engineer, but she really aligns some of the things that really matters to young people and to help them reduce some of the fears or anxiety that they might um, see or feel when they approach some mathematical problems. And she made it so practical and fun, with a lot of fun. Like students were able to pull down their skates, put them back together. They were able to do some music, division, multiplication, addition with their notes and the values. Wow. AI individuals were there, young people talking about their what? Their arts. I mean, it was just interesting. And the culture and the diversity. Those are those areas that grabbed me. Diversity, because each person has something to offer. And when young people see representations, that definitely empower them to be whatever or whoever they want to be as they grow up. And starting from the beginning, they don't have to wait until they're old to accomplish certain goals. No, the they have the support as young ones to grow up and become what they want. And I've started while they're young. So I must say that being at the museum, Westport Museum in Connecticut yesterday was a blessing to me. And I learned so much. I even learned about the hackers, how they can go through a third person to get to your account because they observe the frequency, they study. So we have to be on the alert coming from the technology standpoint. Coming from that standpoint, we, whether we're young or we're old, we have to be aware that there are hackers out there and they're studying you. They're studying the email. So the phishing is important. Yes. And we were reminded of so many different things when it comes to computer and how we forget our passwords and all of that. And I think the presenter who did that aspect of it, cyberspace, he really started off like, how many of you forget your passwords? It was like a unanimous group just saying, yes, we have. Then how important it is to make difficult passwords that are strong. And I said, wow, because I was hacked before. And I know how difficult and challenging and painful that is. So, just a word. So, today I thought of when I saw the collaboration with the team of like engineer, cyberspace person, STEM individual, teachers, professors, mathematicians, that really boost my spirit. And so I've decided, the thought came to me today when I came to my computer, why not talk something on collaboration in nursing? And so I cherished the thought. And I recall times when working as a nurse, when we all worked together, when there were shortages. And when we worked together, we had to get the work done because the patient needed to be cared for. And so we teamed up and it did work. I can recall definitely even during COVID time. But I'm from a background where we had practiced teamwork in nursing before I came to this country. So it's not new. Might be a little different, but it's so, so important because nursing is not a solo job, it's not a solo profession. We all work together for the good of the patient. And it was Helen Keller who said, what she said that little, I'm going to quote her. She says, alone we can do so little, but together we can do a lot, we can do much. And that's so true. So whenever you think like you want to just do it by yourself, get some help and see how faster it's done and how more rewarding it will be. Now, let's think about this. As I said earlier, nursing is not a solo profession. It thrives with so much. It thrives so much in teamwork. And collaboration means working with healthcare professionals, the patients, their families, and this will deliver holistic care. It's also important to know that collaboration empowers patient outcome, reduces error. When we work together, your eye might pick up on something that I didn't, right? And it prevents duplication of work. Pharmacists, for example, can check medication with nurses and vice versa, and better recovery of the patient as a result and patient satisfaction. So think also of how collaboration enhances professional growth. Sharing the knowledge. I learn from you, you learn from me. And it builds confidence in leadership's abilities. It provides different opportunities for different disciplines and across the board. It as a result of that, stronger, more nursing, skilled nursing workforce. I also add to that collaboration reduces stress and burnout. If you were one day talking with one patient, when somebody, another nurse comes, you just turn the patient together. It does make a difference. Less work, less stress. This also creates a healthier, more positive work environment. When you work, you relate, you develop a relationship. You get to understand the other person you're working along with. And nurses will feel more valued. Yes, you helped me to do this. You helped me to insert this IV. You gave me a little technique that I never knew before because of my experience. And they feel more resilient and more supportive. So that's important to help. So as I conclude this section, I just want to say that collaboration benefits whom? It benefits the nurse, it benefits the patient, it benefits the workplace. Collaboration is not optional, it's essential. So I want you to commit with me today that together we will be stronger as we share our knowledge and we support each other, remembering together we thrive. So, my young nurses, regardless of the shortage, when we come together, great things can happen. This will improve by collaborating the quality of care that we offer because we can glean from each other. And at the end of it, the patient, who is the center of our care, will receive that care that provides both satisfaction to the patient as well as to the healthcare team, including the nurses. So let's be committed to work together. And as I said earlier, that Helen Keller said, alone we accomplish little, but together we accomplish much. And you could say it in different ways. When we work together, our outcome will be better. We'll work together. So that's what I have to say tonight. And just as a reminder, let's stay focused. And to you, my young nurses, you're empowered to ask questions, to receive help, and to move forward in this noble profession. Thank you so much for listening and share. I would like you to subscribe to this channel. On YouTube, it's Miriam Amanda Smith. And I'm going to say on Facebook, it's Miriam Smith. Also on podcast is Empowering You Nurses. And on Instagram, what is it? Podcast Mayor. Share with others. I look forward to seeing you soon next week. All right. Have a blessed day. Remember, together we are stronger.